This is Isaac, coming at you live with another installment of the Public Health is Awesome podcast. Today, we're going to be talking about an amazing health communication program just announced that focuses their efforts in reducing obesity within the immigrant Hispanic population of the United States. The program creators are a group that has called themselves Unidad and have been working on this program for quite some time. We all know that obesity is a heavily discussed topic. We're also all aware of the negative influence it can have upon socioeconomic factors. But did you know that it's projected that within the next 10 years, obesity levels are expected to increase by a staggering 10%? Not to mention, that figure is amplified significantly when it's applied to populations with higher health disparities. It's hard to lose weight, but obesity is a major issue that needs to be addressed. The program is striking out with a goal to see a reduction of the prevalence of obesity within the United States Hispanic population by 15% over the next 10 years. Now talk about a hefty and confident goal. Did you know that by simply being an immigrant into the United States, it has been shown that there is a fourfold increased risk at becoming obese? Fourfold increase. How crazy is that? You might wonder, how is that even possible? Well, it's been shown that due to literacy issues and cultural barriers, health information, pertinent to the time, has quite a difficulty in finding a way to influence these groups of people. This program's goal is to focus on Hispanic young people by helping them learn healthy practices, such as healthy nutritional, exercise, weight loss, and weight management techniques, to encourage a positive behavioral change that will ultimately play an integral role in reshaping the demographics environment. Politics aside, the government can be scary. There are issues in the lack of adequate health care and even access to that health care. Needless to mention the lack of comprehensive translation services within rural healthcare systems, where most immigrant Hispanics find themselves living. There are language barriers and cultural differences. All of these disparities contribute into the level of difficulty found in the adoption of healthy lifestyle practices within this population. This program's ideal influence will be had among Hispanic young people. This unique channel will offer access directly into their nuclear and extended families, of which health promotion programs have had a hard time accessing. We all know that family is important, but in Hispanic culture, family is integral. This program hopes that as parents of these young Hispanic people see the positive effects that their children are experiencing from this program, they then will in turn be influenced to change. They plan on having local education systems to adopt their program interventions to help promote and spread the research and reach of this program. Unidad sent us a short message of the success they've had with their program, and we'd like to read that to you. They express, state education systems all over the country are adopting this program and implementing its practices among their students with great success. Of our campaign, John Krasinski of Alameda High School in Los Angeles, California, said, "This is what we've been needing. I've never seen such success and excitement portrayed within our student body in regards to living a healthy lifestyle. The program is fun and interactive and involves the whole family. Their slogan is indeed true, Juntos Podemos." As our pilot programs have progressed, we've seen a positive impact, not only in the students, but their families as well. Jennifer Ramirez Ixlal from Purdue University in Indiana reached out to us upon hearing of our press release and wanted to share their family story. She states, "I'm a first-generation Hispanic American. My family came over as escapees from an estranged government and were refugees from the Spanish-American War. They didn't start having children until their 10th year here in the United States. I'm the oldest of 7 wonderful and amazing kids. Though they've lived in the United States for 30 years now, they still have a hard time reading and writing. We, their children, have always been there to help them translate when they needed it. As a result of lives in hard labor jobs and acculturation issues, their health has declined over the past years. They've tried every wrap and shake their friends sell that promotes quick weight loss and management, but to no avail. I was introduced to this pilot program during my freshman year here at Purdue. After about a year, I finally understood why this was so important, and I brought this into my family. They've been doing it with me, and collectively, they've lost between themselves over 200 pounds. We couldn't have done it without Unidad. My family and I are right along with them in their goal to decrease the prevalence of obesity in the United States among our people, and we cheer with them. Juntos Podemos. Their slogan for their program is Juntos Podemos. And man, can I tell you, this program is on fire. I completely agree that together we can overcome obesity. Together, we can overcome the plague of obesity, a hold on the United States. Together, we can help one another to live healthier lifestyles. Together, we can accomplish anything. There is power in numbers. Juntos Podemos. If you would like to understand more about Unidad and what their program offers, or if your local school systems haven't heard of it or adopted this innovative program, you can find more information on how to advocate for this adoption in your community by visiting their website at sites.google.com/view/Unidad-Juntos-Podemos/home. Again, this is Isaac with another installment of the Public Health is Awesome podcast. We'll see you next week.